Hi everyone, welcome to another episode of Humans for Care Stories from Healthcare Leaders, where we really explore how healthcare teams use AI in the real world settings, right, to improve the way they work and care for patients. Today, we are honored to be joined by Myla Factora, Business Development and Marketing Manager at Capital Medical Center, where she really leads initiative that focuses on patient engagement, marketing, and strategic growth. Today, we will be exploring a specific but very often overlooked source of patient insight, the really numerous chat channels, right, across the hospitals and what we might call the patient inbox. Every day, we see patients asking hospitals about services, doctors, appointments, package, and the next steps as well. But when those conversations are handled individually, the bigger patterns can often be hard to see. Myla, thanks for joining us today. Now, for the first question, where do you think AI makes the biggest difference in hospitals today in patient engagement?
Yeah. Thank you for that question, Ray. I think AI is making the biggest difference in patient engagement by helping hospitals like us become more responsive to our patients' inquiries and to give them more access to their concerns. And patients today expect healthcare communication to be convenient and immediate. So we see that AI allows hospitals to respond faster and to guide patients more efficiently in responding to their concerns. So even beyond operation hours, where we see AI doing their job. So as the human employees go on their rest days and breaks, we have AI agents who can address to their concerns. So I guess that's one of the most or the biggest difference of patient engagement um, brought to us by AI.
Now, we know that in Capital, you guys manage about hundreds, if not thousands, of patient messages every day, right? What can those everyday conversations really reveal about patient demand, patient satisfaction, right? That traditional surveys, feedback forms, or even reports, right, might miss.
Yeah. You see, yeah, you're right. We've been receiving a lot or thousands of messages every day. But what makes the patient inbox specific to what we have right now with BotMD so powerful is that it captures authentic and real-time patient behavior patterns. So we are used to the surveys and feedbacks. We have those reports. But unlike surveys or feedbacks, which often are completed after an experience of the patient, the inbox conversations that we have actually reflect our patient's thinking or feeling or insights at the moment that they are sending the inquiries. So it's a real time capturing of their concerns, of their thoughts. If there are confusion points from their end, if there are emotional concerns or probably service gaps that we need to address, and even unmet expectations. So the traditional surveys and reports do not reflect that, but our inbox, our patient inbox, actually have that data. And over time, we realized that the inbox was no longer just a support channel. So it becomes a live pulse check of our patient experience. So it's like every inquiry, every follow up question or complaints are represents a valuable insight from our patients and our customers. So it's a very good information for us on how to improve, where to improve, and uh, what are the things that we need to continue, discontinue, and those things.
I know you mentioned a lot about patterns, right? Can you share with us and maybe the audience as well? Once Capital Medical Center had better visibility into patient conversations, what patterns really start to emerge? Were there anything that you guys are seeing that you didn't capture before, right? Were there trends that you're like, hey, wow, that was really insightful and I can do something about it?
Yeah. Okay, one of the things that I like about the analytics that we get from BotMD is the monthly performance summary, wherein we see the volume patterns, volume trends, we see peak patterns and strategic recommendations. And based from our actual conversations from our patients, we've noticed that we have very high volume every Mondays. So we need to strategically align our manpower during those days, and we slack off during weekends.
Wow, okay.
Yeah, so it's like on the operational side, we really have to beef up our team on those days, and probably allow them to go on rest days during the weekends
Yeah,
and enjoy it with their family, right? And then we also saw that the peak patterns we have are during 9 a.m. to 11 in the morning, and 3 to 4 in the afternoon. So that's an average increase in our inquiry. So again, we are able to set our manpower strategically in order to address those data that we gathered from BotMD. And these are data that we do not have before. And yet
I
now
see.
it comes month on month. And again, thank you, because this really helped us in aligning and allowing our operation to run smoothly and efficiently.
I see. Now, so you've mentioned about operational kind of efficiency, manpower deployment, right? I just want to probe a little bit um, deeper into that as well. Besides the operational outcome, were there any trends that you see that you could say, hey, I could really increase the revenue of what you're doing, right? Of what we are doing today, increase the conversion that what we're doing today through the reports that you receive, through the insights that you receive from the chat channels.
Yeah, being part of the marketing team and business development, that is actually my number one concern. We need to allow this data to be converted into something that will improve our bottom line growth. Well, from the 3 months that we've been doing this, we number one, we saw improvements in the way the AI is responding to our inquiries, and that answered or successful response to inquiries would result to better utilization. Also, we see patterns wherein most of our inquiries are about billing and payment. So probably from our end, we need to beef up our knowledge bank to drill down the specific concerns that they have about billing and payment, so that inquiry to answers are really fast and quick.
Absolutely. It's always about connecting the dots and increasing the conversion, isn't it? Now, I want to take a step back, right? What advice would you really give hospital leaders such as yourself, right, who really want to start exploring to AI, not just to respond faster, but really to use it to drive intelligent insights happening across that digital channel? What is one advice that you will give them in their journey to start something like this?
Yeah, to all hospital leaders out there, I think we should try to look at AI not just a tool for automation, but it's a tool for listening. That's how we see it, that this information that we get, this data that we get from the analytics, these are patient conversations, and it contains valuable operational and strategic insights that our hospital often overlooks. Diba? It helps organization to move beyond responding faster and towards understanding better our patients. So the key is to treat every digital interaction as meaningful data, as we are now very happy to receive this every day, real time, and being able to compare it month on month. So when analyzed, when this data, when they are analyzed properly, these conversations can reveal a lot of things like service gaps, operational inefficiencies, patient expectations, and opportunities for innovation. So for all hospital leaders out there, AI, it may seem intimidating at first, but really we cannot embrace something we don't understand, but understanding AI and learning how AI can support healthcare workers, reduce friction in workflows, and allow teams to focus more on compassionate care rather than repetitive administrative tasks. And I think that's the very essence of embracing AI. So, well, if I were to summarize Capital Medical Center's journey with AI, our journey with AI transformed patient conversations from simple inquiries into meaningful insights that help us deliver smarter, more responsive, and more patient centered healthcare.
Thank you so much, Myla, for taking the time today to share about your experience. It's really insightful to see how AI could be used not just for automation, which really is what a lot of hospitals are doing today, but really driving the operational excellence, right? That intelligence insight and ultimately the revenue conversion for
Yeah.
hospitals across the region. To everybody watching, has been another episode of Humans for Care. We look forward to bringing you more real life stories from healthcare leaders navigating AI in practice. Once again, thank you so much, Myla, for your time today.
Thank
We
you.
hope to see